A question that commonly comes up with runners is, where do I go to first? A doctor, chiropractic, or physical therapist? And also how to understand the injury a little bit more and how best to recover. So the outline today is pretty much give you context for injuries for runners, and then the difference between a physical therapist, medical doctor, and chiro. And if you have not been to a physical therapist, what it means to go to PT, and some red flags that would navigate towards a medical doctor, and other factors too. So it's usually not a matter of if, but when, and when it does come up, how to navigate that appropriately to reduce risk of further injury and appropriate care right away. The most commonly injured area is the knee, specifically runner's knee or patellofemoral pain. That's like in 50% of running-related injuries, and the definitely most common one I see in the clinic. Secondary is Achilles, tendonitis, or plantar fasciitis. When your muscles and body just don't feel fully recovered after you run, even before runs, if you feel lethargic and apathetic and maybe not motivated, it could be a sign that the body is breaking down and needs a little bit more recovery. Some people feel morning stiffness in the joints or the muscles and tendons after a run, and that's usually a sign of overload and slight inflammation in that tissue. Waking up stiff in the ankles or knees every morning is not a common thing and should be paid attention to. Another early indication of injury coming along is just tenderness to the tissue itself, like the patella, the kneecap, the patella tendon right below the knee, or the Achilles. If you touch it, it could be a little sore and achy. It just could be a sign that the tissue is getting overloaded and needs some appropriate rest. With all my runners, I usually say there's three main things that contribute to your pain that we can help navigate. One is training error, and that's the most common, where people go too hard, too soon, too fast, where the injuries come on a little bit over time, and it's more chronic injuries like the kneecap pain or the Achilles pain. You wouldn't really see symptoms of it until a month into training. So it takes a while to catch up. Another issue that I see is lack of appropriate strength, or I call loading, and mobility, meaning doing squats, doing glute work, and that's very protective against future injury, as well as improve your running performance. Specifically, picking on runner's knee, I love doing some kind of loading with a squat, a split squat, a Bulgarian split squat, because that creates a stimulus for the tissue, specifically the cartilage behind the kneecap, to get more resilient. And because it's more resilient, it can withstand those forces from running. Every time you step, it's about 3 to 4 times your body weight when you run, and so you really have to learn how to offload those forces through the muscle strength and the tissue's resilience. The third thing I usually bring up is running form. Now, no one's ever going to be perfect with running form, but there are common patterns we see. I'll pick on one now, is how you strike your foot on the ground. Midfoot strike or forefoot tend to be the ideal way to contact the ground to minimize ground reaction forces. If you heel strike, it just means you're overstriding, and it puts a lot more force up the chain and thereby more forces at the joints that could increase risk of injury. Those are the three top factors that I talk about with my runners, but I never want to dismiss other factors like lack of sleep, maybe emotional stress going on right now, psychological stress that could contribute to not being focused, tissue breakdown, or not great recovery. So who do I see first if I have an injury? What I want to talk about more specifically are common running injuries. Now, what I mean by that is usually injuries that come on over time as you train. So it's not like you fell off a building or did some crazy injury. It just came on, started to get aches and pains when you're training. So again, no specific traumatic mechanism. And I also want to mention this too with these type of injuries is that high pain doesn't necessarily mean high tissue damage. So just because you have high pain does not mean you have to rush to the ER or get an X-ray. Just give it a couple days of rest and we can see how the pain unfolds. For common running injuries as opposed to red flag injuries, which I'll talk about in the second half of this presentation. So I want to quickly go through 3 types of professions. There are many, like even acupuncture could be on here as well. But what runners or people in general tend to think about when they get injured, where do I go? So medical doctors, specifically family medicine or internal medicine, are great, of course, at a lot of different things, but they're more generalists. So they don't really have a specific background of musculoskeletal injury other than, again, in their medical school, but they deal with a lot more different types of conditions like headaches and stomach aches, stuff like that. Now, there are doctors that can be more specific into sports, like say running injuries, as sports medicine or ortho. They are very good at diagnosis and management of that condition. But the catch is these doctors usually just refer right to physical therapy. So for physical therapists, what do? We do the same tests and measurements that an MD would do, or even a chiropractor. We just don't have the access to making an MRI or injecting you with, say, a steroid or something like that. But for the most part, education is pretty much on the same lines of musculoskeletal reasoning. So there's really no need to go to the doctor to see a PT in that regard. Generally speaking, our modality is exercise, as well as we can do manual therapy, but our modality is exercise. And there's a lot of overlap with physical therapy and chiropractic care. In fact, it's become more of a Venn diagram where chiropractic has great musculoskeletal knowledge, but they deal more with manual adjustments, stuff like that, for hypomobility. But they can also, especially if you specialize in sports injuries, do very similar things to physical therapists where they can do some exercises and appropriate manual care. So when it comes to first line defense for common running injuries, if you want to save time, I would go, and when I say running injuries, is commonplace running injuries like patellofemoral pain, calf pain, Achilles, plantar fasciitis, injuries like that. Just go directly to your physical therapist and they can help determine a diagnosis and a plan of treatment. And if need be, if they don't get better usually by 3 or 4 visits, I go to see the MD because I might be missing something. But for the most part, we can screen pretty efficiently and understand if it's appropriate for our care or not. From the physical therapy experience, what do we expect? Well, we like to see biomechanics. How are you moving? How are you running? We could see how the knee caves in, if you're pronating too much, if you have enough hip extension. Those type of questions we ask when we see a runner. And that could also contribute to maybe why you got the pain in the first place. And generically speaking, we like to see how strong are you, how flexible are you, and not only the physical side, but also more importantly, in my opinion, is how you're training as well. Talk about your exercise background. What are you doing? What's your current training program? When's your race? And all those factors come into play with the appropriate treatment and plan of care for you. So when I say red flags, what that means is when I would refer to medical doctors. The most common one, say, if you fall and you can't bear weight on your ankle whatsoever, that's a referral to maybe check out for a fracture. If you can bear weight, even though it's painful, it doesn't necessarily mean a fracture or anything like that. Usually if you just can't do it at all, that's a little more worrisome. Other non-musculoskeletal issues are unexplained pain that is worse at night, if you're over the age of 50 and have a higher risk of cancer. So you kind of have to watch out for those, especially if the pain has no pattern. Usually for running related injuries, hey, it hurts when I squat, it hurts when I run. That's a pattern. With more cancer type pains, it's like, it comes on and off. I can't quite explain the pattern. It's worse at night. So it's no like ease or aggravating factors. And that's a little more worrisome. If you have abnormal weakness indicating neurologic dysfunction and or loss of consciousness with an injury, you want to get that checked out for concussion and other related issues. Chest pain and shortness of breath could be more serious conditions. Go to the MD. Unexplained weight loss and or night sweats. In and of itself, they're not necessarily bad. You just want to consider them. Acute fever, obviously you don't want to be running if you have acute fever, and that could be other related systemic issues. Now, we can see traumatic falls if you sprain your ankle, stuff like that. So it's kind of a gray area of seeing the doctor or myself. But if you can walk on it, for the most part, just come see a PT. And if you can't, just go right to the doctor. So in those red flag statements, the recommendation is go see a physician. They would, of course, get the care that you need for the appropriate tests, such as X-rays, MRIs, and can help get the care going much faster than, of course, we can. And if I heard those conditions, I would say go see a doctor. A common question I get for a lot of runners and just people in general is, do I need an image to help treat the condition? The answer is usually no. In fact, there's a lot of talk in the medicine world about getting away from images because it could be very misleading. Like, for example, disc bulging. 80% of the people had disc bulges and they were asymptomatic, meaning people that had no signs of pain, stuff like that. So images could be misleading and they don't tell the whole story. So you don't necessarily need an image to find out really what's going on. It's just another tool that you can use to help with information. And if you get the patterns down, it's much more helpful. Now, this is out of the scope of this particular presentation, but we did one in the past of, can I run with pain? General rule of thumb, if the pain is above a 3 out of 10, I wouldn't run. But if it's less than 3 out of 10 and the pain goes away pretty quick, then I'm okay with that. But it's a little more nuances to that. So I recommend going to this webinar, which is about 10 to 15 minutes long. It can give you insight of how to understand if I should run with pain or not. Now, generally speaking, if pain comes on, I would just pay attention. And if it's persistent, then I would take a little bit of rest. It's something that your body may need to do. Expectations on recovery. Now, it's a little bit difficult because it's so specific between people and the type of condition and the severity. But generally speaking, when runners come in and they're dealing with persistent nagging pain of a common running injury, I just say, hey, look, let's just take 2 weeks off just to clear the smoke out of the room and just see what's going on and just to give the tissues a chance to heal. Now, it doesn't mean you can stop biking or doing anything. Yeah, I actually recommend biking, elliptical, strengthening exercises. I'm like, just stop running for a couple weeks. You will not be far at all in your schedule behind. In fact, you probably feel much better come race day if you took those 2 weeks off. And then after about 1 to 2 weeks, when the pains calm down, I reload the tissue with loading exercises, depending on the condition, to increase the resilience of that tissue. And then after a few weeks, if you're feeling pretty good, then I do a walk-run program along with the strengthening. And then generally speaking, depending on the person, the condition, about 6 weeks or so, maybe a little more, they're running pain-free without restrictions. And again, that's a generalization, but it's usually a common place that I see a lot of my runners.